Experiencing these 6 early signs? You might be 1 week pregnant. You might be pregnant and not even know it. There are some very early signs of pregnancy that can manifest even in the first week. If you're trying to conceive, or if you're just paranoid and want to be prepared, it's helpful to know what to look for. So in this video, we'll discuss some of the very early signs of pregnancy. Pregnancy is a life-changing event for women, and many women will experience a unique combination of symptoms. Some of them are common, while others are less common. Sometimes, they overlap with other conditions. Keep in mind that not all women experience the same symptoms, and some of these symptoms might also be caused by other conditions. If you experience any of these symptoms, it's best to take a pregnancy test to confirm whether you are indeed pregnant or not. Nausea. One of the earliest and most unmistakable signs of early pregnancy is nausea. You may start to feel nauseous as early as 1 week after conception, and the feeling may persist throughout your entire pregnancy. Though nausea can be a real annoyance, it's considered a good sign, as it means that your body is working hard to protect your growing baby. Morning sickness. Morning sickness is one of the earliest and most common signs of pregnancy. While it can start at any time of the day, it's most common in the morning. Many women experience nausea, vomiting, and a general feeling of sickness in the early stages of pregnancy. If you're experiencing morning sickness, there are a few things you can do to help ease the symptoms. Try to eat small, frequent meals throughout the day instead of 3 large meals. Drink plenty of fluids, especially water and ginger ale. And if possible, avoid smells that make you feel sick, such as smoke and strong perfumes. Basal body temperature. If you've been tracking your basal body temp to increase your chances of conceiving, you probably know that it goes up slightly right after conception. If you're pregnant, your temperature may stay elevated rather than dropping back down. Of course, you could have another reason for your high temperature, but if it persists for more than a few weeks, then pregnancy may be the answer. Food cravings. One of the earliest and most common signs of pregnancy is food cravings. While they can vary from woman to woman, most women experience cravings for certain foods during early pregnancy. These cravings can be anything from salty foods to sweets, and they can be a real pain when you're trying to stick to a healthy diet. But don't worry, cravings are normal and usually go away after the first trimester. If you're struggling to fight off a craving, try to replace the unhealthy food with a healthier option. For example, if you're craving ice cream, have a bowl of frozen fruit instead. And always make sure to drink plenty of water, especially if you're craving sugary drinks or snacks. Mood swings. One of the earliest signs of pregnancy is mood swings. You may find yourself feeling inexplicably weepy or emotional one day, and then incredibly irritable the next. This is caused by the sudden changes in hormone levels that occur when you become pregnant. While these mood swings can be frustrating, they're usually nothing to worry about. Just try to go with the flow and ride them out. Remember that they will eventually pass. Abdominal cramps. One early sign of pregnancy is abdominal cramps. While these cramps can be caused by a number of things, such as constipation or menstruation, they can also be a sign of early pregnancy. If you're experiencing cramps that don't go away, or that are accompanied by other symptoms like bleeding or spotting, then it's best to speak to your doctor to find out if you're pregnant. Conclusion. Some of these symptoms may not be unique to pregnancy. For example, you might get sick, or your period could start soon. You can also be pregnant without experiencing any of these symptoms. However, if you miss a menstrual cycle and notice some of the following signs or symptoms, take an at-home pregnancy test or go to your doctor. If your at-home pregnancy test is positive, schedule an appointment with your healthcare provider. The sooner you confirm your pregnancy, the sooner you can start prenatal care.